Congestive heart failure, CHF. Definition: represents a symptom complex that involves the failure of one or both ventricles, usually the left ventricle. Imbalance between the demand placed on the heart and its ability to respond results in an inadequate supply of blood and oxygen throughout the body and in congestion of blood within the vascular system. Incidence and prevalence. Most common cause of death in the United States. Prevalence is 5.1 million persons. Incidence is 400,000 cases each year. Incidence of 5% occurs in persons under age 40. The etiology. Underlying causes: heart valve damage, ventricular failure, overload of blood in the ventricles, obstructing lung disease, damage to the walls of the heart muscle. Precipitating causes that place an additional demand on the heart: hypertensive crisis, pulmonary embolism, arrhythmia. Signs, symptoms, and clinical manifestations: dyspnea, irregular breathing pattern, coughing, weakness. The person cannot breathe unless sitting up. Swollen ankles late in the day. Pitting edema, ascites, cyanosis, anxiety, fear, paleness, sweating, cold skin, decreased urine output, frothy pink or white sputum, weak pulse, confusion from decreased cardiac output, thus decreased oxygen to the brain. Oral manifestations: infections, gingival bleeding, and petechiae if displaying polycythemia.